Video, we're going to explore the two main causes of chronic kidney disease. Before we do that, I want to kind of explain what's going on in this little illustration. So this is the afferent arteriole bringing blood into the nephron of the kidney. We have about 1 million nephrons in each kidney. And then about 20% of it will get filtrated into the nephron, which is represented by this green. And then the remaining 80% will leave through the efferent arteriole, and some of that blood will end up going to oxygenate the tubular cells of the nephron. So here's the tubular cells here. So it form like the vasa recta around the nephrons. So the number one cause of chronic kidney disease is diabetic neuropathy. With diabetic neuropathy, you have increased glucose. Glucose then binds non-enzymatically to proteins and lipids and forms something called advanced glycation end products. These will actually damage the lining of the efferent arteriole, and it'll cause arteriolosclerosis. So remember, arteries are big, and then once they get smaller, they're called arterioles. So this afferent and efferent arterioles are pretty small arteries, but for some reason, these agents will preferentially damage the efferent arteriole. So it can either form hyaline arteriolosclerosis, where it deposits proteinaceous deposits, or it can cause atherosclerotic lesions, where you have like fatty acid plaques, oxidized LDL in this arteriole. Either way, the arteriole gets thickened, so it causes a backflow back into the glomerulus here. And what happens is that you end up having more filtration than normal. Now, chronic kidney disease is defined as low glomerular filtration rate, GFR, for more than 3 months. So this is the beginning stage of diabetic neuropathy. You get this thickening, typically like a proteinaceous thickening, maybe some collagen or something like that. Hyaline arteriolosclerosis causes a backflow, and it'll cause hyperfiltration here, where you have a high GFR for a short period of time. And then the body starts trying to protect itself. And so what happens is when you have this hyperfiltration, it activates these cells that are close by, called mesangial cells. When they get activated, they release a protein called transforming growth factor beta. And what it's called TGF beta for short. And what it does is it will activate local fibroblast, and think about the name fibroblast. It's going to create fibers. So these fibroblasts will infiltrate this area and start creating an extracellular matrix of fibers that deposit in this glomerular membrane and make GFR difficult. So diabetic neuropathy, you start with this hyperfiltration, but then after a while you start getting a decreased GFR. And that's because you have all this proteinaceous deposits kind of in between the glomerulus and the Bowman's capsule of the nephron. And they can also form nodules that are kind of something you look for in diabetic neuropathy, called Camestiel-Wilson nodules, and that's what's represented here. So that's diabetic neuropathy, and that's how it can cause chronic kidney disease. Now let's look at the number two cause of chronic kidney disease, which is hypertension. Hypertension, you have a higher blood pressure coming in, and the hydrostatic pressure pushing against the walls can actually damage the afferent arteriole, the one coming into the nephron, not the efferent. So it'll cause thickening in a proteinaceous deposit, so it's hyaline arteriolosclerosis with hypertension. So you get this thickened afferent arteriole. So you have less blood coming in, and that means less oxygen coming in to the mesangial cells that are close by, and that sets them off again. And the same process takes place. These mesangial cells will release transforming growth factor beta. It'll activate fibroblast. Fibroblast will come in and release extracellular matrix proteinaceous deposit between the glomerulus and the nephron, slowing down the glomerular filtration rate, which for more than 3 months qualifies it as chronic kidney disease. One more thing I want to add. With diabetic neuropathy, when you have this thickening in the efferent arteriole, that means less blood is coming out the efferent arteriole. And that blood is actually the blood that nourishes the nephron, the tubular cells of the nephron. So as it goes down, there's less blood and less oxygen going down, and it can actually eventually cause necrosis of some of the tubular cells. And that's just another complication that can happen with the diabetic neuropathy. So that's a little bit of detail. I think it's important to know the two primary causes of chronic kidney disease.